chapter, so get ready for those questions. I'm Dr. Jolene Brighten. We are rolling into why does the gut matter so much in your hormonal health, and what can you do to recover your gut after birth control? We've got to talk about SIBO, yeast overgrowth. We got to talk about yeast dysbiosis, bacterial dysbiosis, leaky gut, and all sorts of things. So as you're coming on, say hello. We're going to roll through the chapter. If you are just joining me in this series, we have been going through chapter by chapter of Beyond the Pill, and we've been doing a virtual book tour and really doing a virtual book club, right? And so I'm going to be answering your questions, but first, I'm going to go through the chapters. If you're new to all of this, go back and watch the other ones because we go into things like period problems, heavy periods, irregular periods. We talk about post-birth control syndrome. We've already talked about liver detox. And so there's a lot of good videos that you can catch. And remember, if you're on Instagram right now, these are being recorded on YouTube Live. So if you are needing to watch this right away and you're like, cannot wait for me to upload it, then definitely head on over to YouTube. And if you haven't subscribed there, do that because that's when you know I'm going live or every time I upload a video. So I'm going to open up the gut check chapter here. That is chapter 6. And in chapter 6, like all of our chapters, we have our preview. What is in this chapter so that you can know what you're getting into? So number 1 is the pill, leaky gut, and your hormones. Why does your gut matter so much in hormonal health? And what does leaky gut got to do with it, right? Why you can't ditch those extra pounds. So there's a connection here in terms of gut health, hormonal birth control, your hormones, and inability to lose weight. We talk about the pill's role in autoimmune disease. This has been a big aha for a lot of women who have read the book, making the connection with autoimmune disease and their hormones. And really, I've heard from so many of you who have said, I had no idea that you were going to teach me about autoimmune disease in this book. Yup, I gotcha. We're also going to talk about how good gut health can undo the effects of the pill and balance your hormones. That's the stuff we all want to know, right? And then lab tests for personalized gut check. So what lab testing should you get done? So I like this little section. You guys, if you heard the other videos where I'm like, I think I'm funny, this is one of those times I thought it's funny. Your microbiome, gut, and hormones are all BFFs. So what does that mean? Is that your microbiome and your gut health and your hormones, they all work together. And really, the metabolites of your hormones can help support your gut health. Your gut health supports metabolism of your hormones. They're BFFs. They love to hang out and have a good time. And in this chapter, I also talk about the role of the gut in estrogen dominance. Now, in previous chapters, we already talked about estrogen dominance in chapter 4. But here I talk about, okay, let's go a little bit deeper. What do you need to know about your gut? Because I mentioned it, but we need to know a little bit more about it. And then true to Beyond the Pill nature, we've got a quiz. And so this quiz is to help you go through, really get dialed in on how is my gut health. So, hey, how is my gut health? Do I have food sensitivities? Do I have IBS? Do I have heartburn? Do I feel nauseous often? Do I have eczema, psoriasis, hives? Do I take things like NSAID? Is my tongue swollen or has a thick coat? If so, you may have yeast overgrowth in your mouth. And with yeast overgrowth in the mouth, this is very common with hormonal birth control. In fact, the research out of dentistry, so dental practices, have shown that yeast overgrowth is very common in women who start the pill, and then it doesn't necessarily just reverse itself once you stop hormonal birth control. So that's an important thing to know, because if you have yeast in your mouth, you're swallowing it over and over and over. And so that can inoculate your gut. So I go into how the pill wrecks your gut. This is something I wish I would have known when I was younger. And this is part of like how I got started in all of this and what I was observing in my clinic. I would have women come to me because they had gut symptoms. So they had gas, bloating, constipation, diarrhea, foul smelling stools. Maybe they had food sensitivities, all the stuff we don't want to talk about, but we got to talk about. And so with that, they would come to me and they'd be on the pill, or they would have hormonal birth control of some kind in place. And what I'd noticed is that we would only be able to get them about 80% better. But when they finally decided to stop hormonal birth control, it was like they were 110% better. Like they far exceeded expectations in terms of how much they were going to be able to heal and how much they felt better. And so I started to investigate in the research. I'm like, why is that? And as it turns out, hormonal birth control can induce leaky gut. So this is known as intestinal hyperpermeability in medicine, and the common term is leaky gut. And I explain that here, that leaky gut Your gut should have nice tight junctions here between the cells. This is leaky gut. All these big proteins are getting through and lighting up your immune system. So I take you through what is leaky gut. We talk about PCOS, polycystic ovarian syndrome, and the connection to your gut. So there is a new theory, the dysbiosis of gut microbiota, dogma theory of PCOS, that is saying that, like, PCOS is rooted in metabolic and inflammatory issues, but there's a gut component, like everything, right? So we talk about what is leaky gut, and I prep you for that because we have to talk about how the pill is really gasoline to autoimmune fire. So if you already have autoimmune disease, the pill is like throwing gasoline on the fire. It can just make it burn so much brighter, and that's not in a good way, ladies. And so with that, I also talk about how the pill can induce leaky gut and induce an autoimmune disease and what it takes to develop autoimmunity and why you can't necessarily heal autoimmunity while you're still on the pill. And I've had a lot of doctors reach out to me after reading the book and reading this chapter, and they're like, this makes so much sense to what I've been seeing clinically. And now they're like, I have to change. Like, I have to support women in coming off of birth control if they have autoimmune disease, because these are the women who they end up developing multiple autoimmune diseases. Once you get one and your immune system has like lost track of who's who, that's what it does in autoimmune disease, and you've lost tolerance to yourself, you start losing tolerance to other tissues as well. So it might start with Hashimoto's, and then it might end up turning into, psoriasis. You might also have pernicious anemia. Like, there's a lot of tissues that your body can attack, which means there's a lot of ways that autoimmune disease can show up. I'm drinking collagen sparkling water today, by the way, which is so appropriate because I talk about collagen in this chapter to heal your gut. And so I'm in a hotel room. I always travel with collagen packets. I opened it up and threw it in some Pellegrino and was like, there you go, collagen sparkling water, a little gut healing, a little glycine to help my mood be stable today. So I go through what causes leaky gut besides the pill so you can identify what else could be going on in your environment contributing to that. We talk about how mom's microbiome is baby's microbiome. So hey, nutrition for naughty people, good to see you on here. If you want to get pregnant, you have to work on your microbiome. You pass that on to baby. And when you pass that on to baby, this sets baby up for lifelong health or lifelong issues. Not to be like, dun, 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 like you have this huge responsibility as a mother, but you kind of do. You do the best you can in a world that is mostly out of your control. There are things that you can control, and those are the things that you pick. And so things you can control, the things you put in your mouth. So your diet, probiotics, making sure you're pooping every day, all of that kind of stuff is within your control. And that is something that gets overlooked in fertility and in helping women have the best pregnancy outcomes and the healthiest babies. So we talk about that in Beyond the Pill. And then here we get into all the autoimmune talk. So you can't talk about women's health and not talk about autoimmune disease. So there's a lot of really great books out there. There's books on autoimmune disease, books on women's hormones. There's no book on like birth control protocols. This is like the first. This is the OG. Oh my God, I get to say that about my book. I just like had that epiphany and you're witnessing it right here. And I know I'm a total nerd, but whatever. I'm going to just be giddy about that. But what I tried to do is I looked at like, what are the common women's health issues that women come to me for? Like, what are they writing at the top of every chart note, and bring those together in a book to make a comprehensive book to support women's health, which also includes birth control, because a lot of books and a lot that's out there for us has forgotten that birth control is absolutely part of a woman's journey. And maybe you never took it, but it came up in a conversation at one point. So it's always been part of our journey. And so it has to be a part of the conversation. And so what I brought into this gut check chapter is this autoimmune connection. So I spent 10 years on the pill myself, and I always have in the back of my mind, how did that contribute to me developing Hashimoto's and the autoimmune diseases I have? And I've seen so many times where women, they start the pill and then they start having gut issues and symptoms go on. And then before they know it, they have an autoimmune disease. And in the book, I talk about the Harvard study that showed us that women who have a family history of Crohn's disease, so that means you have the gene. So you can get tested for this and know, do I have a genetic predisposition to developing an autoimmune disease of Crohn's disease, ulcerative colitis, which are in the family of inflammatory bowel disease. And if that is something where it's like you have that family history, you spend 5 years or more on the pill, and you have a 300% increased risk of developing Crohn's disease. This is no joke. This is a condition where you get ulcers in your intestines that can perforate and spill contents, fluids from the intestines that should be contained out into your body. You can die. You can become septic. You can become malnourished. And I'm not saying this so that you're like, whoa, you're freaking me out. It's like, it's too early in the morning. I need some coffee for all this, like, scary talk. But it's because we need to have these real talks, because so often, it's something that, like, these studies come out, women feel concerned, doctors are like, meh, it's a low risk, like, don't worry about it. But it's like, what are we talking about here? We're talking about something that could potentially rob a woman of her life, chronic conditions of any kind. Who takes care of families? We do. We take care of our parents as they age. We take care of our children. We take care of our spouses, our partners. Like, we are caretakers to the human race. So women's health issues are an issue of the entire species surviving and existing. And a woman's chronic condition, a woman developing a chronic disease, means that her entire family unit and community will be impacted by that. So these issues, well, in the United States, we like to be like, that's your problem and that's very individual. And we have these individuals, and we want all of our autonomy. That's great. But we also have to recognize that we are connected to a community that depends on us and that we depend on, and that these chronic diseases can impact that. And if you impact someone's community in a negative way, that can lead to further chronic health issues. So, I know that's like heavy to lay on you, like first thing in the morning. If people are going to rewatch this, be like, what is she talking about? Well, I'm talking to you early on a Saturday morning. That's what's going on here. So with autoimmune disease, we talk about what triggers autoimmune disease, talk about the intestinal permeability, genetic predisposition, and the triggering event. That's what I call the 3 ingredients to developing autoimmune disease. This is out of Dr. Fasano's research. So I didn't originate this research. I just used the fun language of baking a cake. Like, this is the ingredients. And I talk about the estrogen autoimmune connection, because this is something of like, who gets autoimmune disease? We do. Women get autoimmune diseases at a much higher rate. So we talk through that. I take you through the lab tests. So yeah, I'm freaking you out a little bit, maybe. Don't worry, I got you. Here's the lab test. You can know when you test for antibodies. Now, in my clinic, I don't wait for you to have symptoms to screen for Hashimoto's antibodies. And then if you are starting to have like vague symptoms, we are screening for other antibodies. And the reason for that is because antibodies in some diseases can show up decades before the disease develops. And well, conventional medicine will say, well, I don't know what to do about that, so I'm not going to test it. Totally fair. If you don't know what to do with lab results, then don't order them. But well, they'll say like there's nothing you can do about it. There's actually so much you can do about it. Like conventional medicine, what they have for treatment for autoimmunity are big gun drugs. Like they have drugs for you. And that's great that we have options and we have those tools in our toolkit. But it's also a situation of like, but what if we saw the antibodies before there was the disease and we could reverse that? And that's part of what I'm teaching you in Beyond the Pill. Because women, with Hashimoto's in particular, that's the number one autoimmune condition that affects women. It's an autoimmune thyroid disease. We'll be talking about that more as we get into the adrenal and thyroid chapter. Women are 5 to 8 times more likely to develop that disease. So why don't we screen them? I screen all the women in my clinic on an annual basis to understand, okay, does she have the risk? Like, are things coming up? And especially if there's a family history. So I talk you through, like, before you get on the scale, check your gut, because sometimes we eat right, we exercise, we do all the things right. But what we know now from the research is that what is going on in your gut can influence your weight. We go through lab testing. So what lab should you have done? What is SIBO, small intestinal bacterial overgrowth? Do I have it? We talk through that. And then I take you right into the gut repair protocol. So in the Brighten gut repair protocol, the acronym is NEAT. So we're going to nourish, eliminate, absorb, and terrain. Nourish is to feed your gut and the nutrients it needs for optimal health. Eliminate is to remove aggravating foods from your diet. Absorb is to support digestive function, to absorb nutrients. And I just want to say on this piece, you are not what you eat. You are what you absorb. And there was this brilliant woman whose name is falling out of my head who said this a long time ago in a book, and you'll hear it all the time, and it gets attributed to like everybody. And really, I think everybody is saying this in the naturopathic arena, is that like you are what you absorb, not just what you eat. And then terrain is about optimizing the environment of your gut and all the critters it houses. So, while there are some, I really want to just like honor that, there's great doctors out there who are recognizing that we need probiotics and they're important, but you can't just give a probiotic and expect that you're fixing everything. It's one piece of the puzzle, but you have to set up the terrain so that those critters actually want to live there. So I take you through each steps of the protocols, giving you nutrients, guidance, what you need to know. I have my upgraded golden milk in there, which is like one of my favorite recipes ever. For people who are asking about N-acetylcysteine and NAC, that this is one chapter where you will learn about that. I talk about it later on as well. And I talk about how to eliminate, what to eliminate. I give you dairy alternatives because post-pill acne is real. Acne is a big reason why we get on birth control. Acne is a big reason like why we feel like our hormones, our body hates us. And dairy is something that you can eliminate and you may possibly get results in clearing your skin. So I give you dairy alternatives. And then I go through like how to quit gluten. I know nobody loves quitting food, but know that the Brighten protocol diet in the back is focused on bringing in so much good food that you don't even notice that you're not eating gluten. You're like, whatever, this food's so good. I'm so happy. Like, it's all good. Talk about caffeine replacements because we've got to test what's true for you when it comes to caffeine. And then I give you a little table, like what's in, what's out, so that you can quick reference it. I love quick references. I wish every book, like it's just the way I learn and my brain functions. I wish every book just had like, yeah, here's the text and here's a quick reference, so that you can look at that. I talk about things to help absorption. I see some people saying a lot of us have absorption issues. It's true. We talk through the terrain, how to really love up your terrain, and keep it right. And then when we get into the key takeaways, I'm talking about how important, again, and reiterating the gut hormone connection. So I've got a few minutes here because I am at the Bulletproof Conference and I do have to run in a bit, but I want to spend some time answering your questions about the gut check chapter. Anything you learned that was a big aha for you? And is there anything that like you just listened to now that you're like, wow, I really didn't ever make that connection? So if you've got some gut questions, I'd love to hear that. I saw that there were some questions about yeast overgrowth. So while you're on hormonal birth control, because it lowers microbial diversity, so the number of good gut bugs, it can actually make it so that yeast, which is opportunistic, can overgrow. And currently, I have a new article for you at drbrighten.com that's all about natural solutions for vaginal yeast infections so that you can get some root cause solutions in terms of like what might be going on with that and get some quick treatments. This was something that like we couldn't fit in the book, me going into like 5 pages about yeast overgrowth in the vagina and natural treatment. So I put an article out for you to accompany the book to make sure that you're getting extra support. The book is so loaded with so much information. And really, you guys have said I need to write a series, and I just might. Candida does not mean leaky gut. Candida is fungal overgrowth in your intestines. So Candida can be Candida albicans is like the most common that we see overgrowing. So Candida is the organism. If you have leaky gut and you have yeast overgrowth, those yeast bodies can get through and those can trigger autoimmunity and trigger inflammation and immune system symptoms. Somebody's trying to answer your question there, but I think autocorrect got you best of you because I'm like, there's a few words there that confused me. You've seen a correlation between estrogen or excess free estrogen and autoimmune issues. Would you elaborate here? Yeah. So I talk all about this in the book. With estrogen, estrogen helps with modulating the immune system. And it seems to be the way we're understanding it is too much estrogen is bad for the immune system and too little estrogen is bad for the immune system. So women with estrogen dominance, that can push the immune system imbalance, which is like a Th1, Th2, Th3 dysregulation in the, all you got to know is it's the immune system and it's different branches of the immune system. And excess estrogen from the research and what we come to understand can push that out of balance. But we also understand that estrogen actually is protective in autoimmune disease and having a robust and healthy immune system. I don't know, I'm air quoting healthy, but I did that. And I'll just own my mistakes there. So with that, if like what we see is that when women go into menopause and their estrogen drops, then that's usually when autoimmune disease flares. They have a new onset of autoimmunity, or they're feeling a lot worse in their body with their immune dysregulation. And so I actually use estrogen therapy in my practice in postmenopausal women to help with bringing their autoimmunity into balance. So women that have lupus, way more tricky when it comes to estrogen, and we understand that estrogen connection much better than most other autoimmune diseases. But in addition to that, like I've had women with like scleroderma that like and Crohn's disease and these other conditions where it's like you're only looking at big heavy pharmaceuticals. We actually bring in estrogen therapy and progesterone, bioidentical therapy to help modulate the immune system while we work on everything else. How would you treat H. pylori without antibiotics? So if you're going to treat a condition like H. pylori without antibiotics, you want to be working with somebody who's well versed in that, because there are an array of herbs and like things like mastic gum and things that you can use naturally. But it's not going to be just about treating the organism. It's also like sometimes with H. pylori, there's concurrent things going on in the stomach and in the rest of the intestines, and we have to be looking at that as well. I actually had H. pylori when I was young. So it was about 7. I started having a lot of digestive issues. Medicine didn't discover H. pylori at that time yet. It wasn't in practices with the research getting to doctors. So I struggled for about 10 years being very sick. I would throw up after meals, have major heartburn. I had an endoscopy diagnosed with gastritis at, I think it was like 9 or 10. And with that, my doctors couldn't figure out what was going on. And they finally just concluded that I must just have an eating disorder and I was seeking attention and that I was broken in some way. And like it was mental, it was in my head. And then when I was 17, I saw a doctor who, when I saw him and I was complaining about like, oh, what's going on in my gut, he's like, you have a history of chronic gastritis, which is weird in a child. You shouldn't have chronic stomach inflammation. That's like something that happens in elderly people. So to see that in a child in elementary school, that's a weird thing. That should make you want to ask why. Like, what's up with that? And then to be like, oh, you're probably just seeking attention. Except that you looked in my stomach and you saw it was inflamed. Like I wasn't seeking attention to the degree that it was like able to manifest gut inflammation in that way. So with that, I saw this doctor and he's like, I just was at this conference. They just presented this study on this thing called H. pylori. We have a test for it now. Let's do that. At this time, so this is when I'm 17, it's an endoscopy. They have to take a sample of your stomach and look at, do you have H. pylori? And sure enough, I had it. And I went through a round of antibiotics, and 2 weeks in, I developed an allergic reaction to amoxicillin, which was really fun to be 17. I remember nobody was home, and I had this huge welt on my head, and I was like, what? So with that, I had to do another round. So I did like 6 weeks of antibiotics. H. pylori is one that's near and dear to my heart. Now, what's interesting about H. pylori is that some people have actually, found that, they go out and they do this research that people live with H. pylori, and it might be something that's actually normal to have in our gut. The issue is that when it overgrows. Can H. pylori come back? Yes. If you don't eradicate an organism completely, it has a chance to come back. And with H. pylori is one that organism is so smart, and it shuts down your parietal cells from making hydrochloric acid, which is where we often get heartburn, is from low hydrochloric acid. We actually need to raise hydrochloric acid so that the stomach acid hits the esophageal sphincter, which is the gatekeeper between your throat and your gut, and says, yo, let nothing through. Like, it's like, Gandalf, you shall not pass. And that's what should happen. But you have to have ample stomach acid to really stimulate that. If probiotics make you feel you're bloating worse, what should you test for? Small intestinal bacterial overgrowth. So I talk about SIBO in the book. I also have articles about this at drbrighten.com. And that is why you'll read in the book that I recommend spore-based probiotics. Specifically, Megaspore is the one that I've used in my clinic. It's part of my period problems kit. And you'll read about it in the book because the Megaspore has actually been shown to be beneficial in people that have small intestinal bacterial overgrowth without the same flares that like lactobacilli species and bifido can cause. So that's one thing that I would look at. Can you have SIBO without notable symptoms? 100%. Let me tell you this story. I'm going to end on this story. My husband, He was having bloating and burping all the time. And I was like, you have SIBO. So we tested. He's like, I'll only do this test if you do this test because it's a 3-hour test. We got to do all this prep and like, you got to do it with me. I'm like, whatever, I'll do it. Like, I want to screen. So I do the test. He has mild elevated SIBO gases and he has overt symptoms. I had no symptoms. After I did the test, I was wicked symptoms. Like, I remember I ate some cherries and I bloated so bad. I thought I was like writhing in pain in bed, and my husband was about to call 911 because he thought I was dying. And I was like, this is just bloating. This is bloating. This is what bloating looks like. Anyone who dismisses bloating, jog on, because you haven't had it, because bloating is awful. Bloating is inflammation in your intestines. It's sometimes can be gas, but I always ask my patients, do you pass gas or do you just feel bloated? Most people just feel bloated. That is inflammation in your intestines, stretching the intestines and pissing off the nervous system. It is as bad as it sounds. So I actually didn't have symptoms of SIBO. I did the test. My gases were some of the highest gases that I had ever seen. And I was like, whoa. And that really woke me up to the reality that, like, you know, even so, we know with celiac disease, we know with leaky gut, we know with gut dysbiosis, you may not have gut symptoms. You may have skin symptoms, mood symptoms, headaches, all of that. But it woke me up that like SIBO is one of those things as well, that it may not manifest in the gut. And in fact, in women who we can't get their iron levels up, I often find that there's SIBO there. So if you have a low ferritin, heavy periods, we're working on everything. And I'm like, why can we not get your iron stores up? What's going on? We're trying to heal your gut. I'm like, we got to look at like, do you have SIBO? And sure enough, it's there most of the time. Yes. So yeah, SIBO and Hashi's totally go together, because with Hashimoto's, if you have too little thyroid hormone, you don't have good gut motility, then the good guys, SIBO is good guys. Okay. Understand that. They're not bad gut bugs. They're really, really good ones. Those good guys can make their way up the intestine, but they shouldn't be in your small intestine. That's where they cause problems. They are awesome in your large intestine. They are haters in your small intestine. They're just trying to survive though. Broccoli, if it causes you gas, bloating, any intestinal distress, could be low stomach acid, and it could be small intestinal bacterial overgrowth, which is why I talk about eating broccoli sprouts in my book, because I've not seen somebody with SIBO. My SIBO patients can tolerate broccoli sprouts, and they are way more potent in terms of like the good stuff you get in broccoli. You get even more from broccoli sprouts. And you can eat something as simple as a quarter cup throughout a day and still get the nutrients that are going to support liver detox, estrogen metabolism, help your hormones feel well. And then in addition, also not blow you, because that's like the worst. And I see some of you saying bloating is the worst. It's something that like, when you get taught about bloating, it's like when you get taught about anxiety in medical school, it's kind of like, oh yeah, bloating, like you're not going to die, right? So it's like, oh, bloating, like they're freaking you out as doctors. They're like, we're teaching you how people die. Like, this is how people die. Be scared of this, but like bloating, no big deal. Anxiety, no big deal. The very first time I had bloating, I was like, this is like, you can't even function. You can't even walk. Like, this is the worst pain ever. And then the first time I ever had anxiety after having my son and having Hashimoto's, I was like, this is like the worst sensation ever in my body. And it really, I'm so grateful for my own health struggles and experiences, because it absolutely shifted and changed the way I practice and how I wrote to you in Beyond the Pill. Can the birth control cause interstitial cystitis? Yes, it is related to interstitial cystitis. If you have IC, then you want to go to gut check and check that out, because leaky bladder and leaky gut, they're BFFs too. If you have leaky gut, you have leaky bladder, and vice versa. And so healing your gut is part of that. Drinking collagen can be super helpful in all of that. You ordered Balance from the website. I currently take gut flora and probiotics. Should I discontinue while using Balance? Nope, no contraindication to that. I take probiotics with my Balance. There's no contraindication to that. So thank you so much for being here. If you have grabbed Beyond the Pill, go to beyondthepillbook.com and grab your gratitude bonuses. We've got meal plans, exclusive interviews there for you. There's a nutrient depletion. There's a lab guide, all kinds of goodies to help support you. I appreciate you being here. I will be back tomorrow. We will be rolling into chapter 7. We're in chapter 6 today, and I'm seeing that on my screen. So we did the gut check chapter today, and then we are going into energize your thyroid and adrenals, and then we'll follow it up with the reversing metabolic mayhem. So for all my adrenal and thyroid people, come back. We got to talk about this tomorrow. We got to make this happen. So we'll be talking through this. If you missed me going through chapters 1 through 5, they're all on YouTube right now, and I'm loading them up to IGTV, so you can also check them out there. I appreciate you so much, and have a great weekend, all of you.